In this video, I am going to talk about osteoporosis, which is a bone complication that commonly occurs in patients with sickle cell disease. This is an informational video that will discuss what osteoporosis is, its signs and symptoms, its diagnosis, and its current preventative treatment. Osteoporosis is a bone condition characterized by decreased bone density, which is the amount of bone minerals such as calcium in a certain volume of bone. Since bone minerals help keep bones strong, a decrease in bone density causes bone to become weak or fragile. This makes it more likely for bones to break or fracture. In patients with sickle cell disease, osteoporosis most commonly occurs in the vertebrae. However, it can occur in other bones such as the hip and wrist. Typically, the first symptom is bone fracture. Before bone damage occurs, there is usually no pain or noticeable symptoms. With osteoporosis of the vertebrae, the first sign of fracture may be a decrease in height or a slumped back, since pain is not always felt due to initial fracture. X-rays, which produce images of the bone, are used to see if there is a fracture, but they do not tell us anything about bone density. Bone mineral density tests are necessary in order to diagnose osteoporosis. The most common type of bone mineral density test is DXA, which stands for Dual Energy X-ray Absorptiometry. It measures bone density at the hip and spine. The number obtained from this test is converted to a T-score. A T-score allows doctors to compare the results to healthy bone density levels. A T-score of 0 is the baseline. It means your bone mineral density is the same as most healthy adults. 1 to 2.5 units below 0 is considered low density, and 2.5 units below 0 or lower is considered osteoporosis. Ensuring adequate vitamin D and calcium intake is essential to maintaining bone health. In some cases, doctors may recommend taking supplementary calcium or vitamin D as treatment. Bisphosphonates are a type of medication that may be used to treat osteoporosis once there are clear symptoms. Exercise and physical therapy may be recommended as a preventative strategy for maintaining bone health. If you are currently experiencing any of the symptoms discussed in this video, talk with your doctor about future healthcare plans.